Thank you for joining us for Creative Healing for Youth in Pain, or CHIPS, June webinar on biofeedback, or training our bodies to heal. I'm Dr. Rebecca Cherry. I'm a pediatric gastroenterologist and hypnotherapy specialist, and I'll be serving as the moderator for today's webinar. For those of you who may be new to the community, CHIP is an online nonprofit organization dedicated to empowering youth living with chronic pain to heal by altering the brain's pain circuits through exposure to creative healing experiences, educational resources, and peer support. Today, we are thrilled to be joined by Dr. Will Frye, a pediatric psychologist who is board certified in biofeedback. Before we begin, I'd like to review a few housekeeping items. First, please enter your questions in the Q&A, the chat box throughout the webinar. I'll incorporate audience questions throughout the conversation today. Second, the webinar is being recorded. A replay of the webinar, along with previous CHIP webinars, is available on CHIP's YouTube channel. And finally, I'd like to ask you to consider making a donation of $25 to CHIP if you find the monthly webinars valuable. Donations can be made at mychip.org/donation. So we are ready to start. Thank you for joining us today. Dr. Frye, you can take it away.
Well, yeah, first, it's just wonderful to be here. This is actually my first time really doing much with CHIP, so glad to be here with your community and being able to talk a little bit. Today, I wanted to talk more about biofeedback, and Dr. Cherry is going to help me with some of that. But just to make sure that everybody has a good understanding of what it is, usually when I think about chronic pain recommendations, there's a lot of things that come with it. You've probably experienced that yourself. They'll say, hey, you need to go to physical therapy, or maybe occupational therapy, or you need psychology, or you need to learn these relaxation skills, or go do biofeedback. And a lot of times that leaves people scratching their head with, well, what exactly is biofeedback? How do I even know if I'm doing this? Or where do I get it? What would those skills entail? And hopefully we can answer most of that today and make sure that you have a good understanding of it, and hopefully can help you out with wherever you are on your own pain journey.
Great. Yeah. So if we could just start with the basics then. What is biofeedback? Which sounds so mysterious.
Yes. It can be a pretty simple definition. The way I usually first describe it, especially when working with kids and teens, is it's getting feedback on what's happening inside of your body or your bio. So understanding what that is. So typically what we do is we have different instruments and sensors that look and see what's happening with your autonomic nervous system. If you're not familiar with that, you might be familiar with the words your fight or flight system, your sympathetic nervous system, or your rest and digest, your calm system, your parasympathetic. And those two systems are supposed to be pretty well balanced throughout the day and just adjusting to all the things that happen throughout your day. But biofeedback helps read that. It helps you understand how those two systems are coordinating together, and then also allows you to build some control over it. So typically what would happen is you'd be hooked up to some sensors, which I'll show you in a second, and then you'd be able to have those sensors attached to a computer screen or something like that, where you'd be able to see what is happening with my breathing or my muscle tension or my temperature or other things, and then try to play with it to change it, to get it back regulated. So really quickly, because maybe you want to know what these sensors are like, I have some around me. They're pretty simple. First, usually there's something like this. If you're in a hospital setting, usually they're called a pulse ox, but something that just slips on the finger, non-invasive, nothing painful with this or any of them. And what it does is reads what's happening with your blood and your heart rate through your finger. This is a nice place to read it. And so typically it's either here or sometimes they'll clip onto your ear. So nice and painless. Oftentimes there will also be a belt. So this is a belt that goes around somebody's abdomen. It's nice and stretchy. So whenever you're breathing in and out, it can read how you're breathing, especially if you're doing it with your diaphragm, which is where we want you to breathe if you're doing slow breathing, nice and slow and low. We have other things. Unfortunately, my Velcro is getting stuck together. Sometimes we'll look at how much you're sweating, so we can look at look at it on your palm or on your hand. And usually it's just little electrodes like this, so they wrap around the finger and then read how much sweat is going on. Again, totally painless, easy to do. And if we think about the stress response. The more stressed we are, the more heat happens in our body, which causes us to sweat. And stress, strain, anything doesn't have to be emotional stress. We also have a similar one for muscles, and there's a couple different ones of these that can happen where we put these little sticky electrodes on you. Again, this is totally painless. They're nice and sticky. I have hair on my arms, and even pulling them off of it, if you get the right ones, they don't even hurt. So it's wonderful. But you can put it at different places on your head, on your shoulders, or wherever it might be to look at muscle tension, to look at imbalance between tension, and then, of course, get a nice feel for how do I change this. And lastly, the ones I have in front of me, we got temperature. This is just a little thermometer, which you can tape onto your finger, and it's going to read what the temperature is in your peripheral. The reason we do that is because as we get more in the stress response system, we recruit blood to these major organs here, and we get less blood flow out in our hands, which makes our hands a little bit cooler, which is kind of weird because you're hot here, but you're cold here. If you've ever heard the phrase cold and clammy hands, that's why it happens. Your hands are cooler because your body's using these organs and this part's hot, but because your body's hot, you're sweating, so your hands are cold and clammy. But all of those sensors are used to help figure out what's happening in your body, and then, of course, how do we change it and get a good feel, a good awareness for it. So that's biofeedback in a nutshell. And Dr. Cherry, I'll throw it back at you.
Is there just one kind of biofeedback, or what kind of options are there?
Nope. Well, I think we could keep talking about all the different types because there's plenty. Each of the different modalities I just showed you, each of these different sensors, we could call something different. So, for instance, we might say, hey, we're going to use this to look at your heart rate variability. That's how much the heart rate is changing beat by beat, which we want some of. And is it a good, healthy beat? We could also look at what's your skin conductivity. We could look at what's your temperature or your muscle tension. And I could say each of those is a different type of biofeedback. I'm training something different. There's also plenty of different systems to train biofeedback. So I have 3 different biofeedback systems here in my office, and there's dozens and dozens and dozens of other ones. They usually all look at either your heart rate variability or your respiration. So we're really focused on the heart, the lungs. That's the main area. But then there's also neurofeedback. And neurofeedback looks a little different. I don't have it in here, but it's typically a cap that you would put on your head, and it has a similar type of stickies like this. They're usually a little bit bigger, and they're going to look at brain waves. A lot of people use it for things like ADHD and trying to calm some of those brain waves that are associated with being overactive. So we call that neurofeedback. I don't do it so much in my practice. There's a little bit more evidence for the biofeedback, so that's more of what I do. But you could say that any of these are a type of biofeedback, although anything you do that gives you feedback on what's happening inside your body can technically be considered biofeedback. So think about what you have. If you have an iPhone or an Apple Watch or a Fitbit or any of those things that tells you to breathe every once during the day or to do something else, it's reading what's happening inside of you and it's giving you feedback on that, which I would still say counts. So yeah, any of that could be considered biofeedback. Again, anything that gives you information of what's happening inside this area.
Fast does that happen? How quickly can you make it help?
It depends. A lot of these skills, I mean, if we think about them, especially for anybody on this, if you've been in this chronic pain journey for a while, you've probably heard some of these. Diaphragmatic breathing being the one, or deep breathing, you probably heard probably more times than you'd like to hear ever again. For some people, it comes pretty easy. They're really good at it. They do the diaphragmatic breathing. It's right in their diaphragm. They have no problem with it. It feels great. And you can get that pretty quick going. And the biofeedback for it is then more of just becoming aware and then generalizing it to other situations. Some of the other ones are tougher, especially when we're talking hand temperature with, I'll give the visual, with this one. What we literally do in here is we'll have people try to change the temperature of their hand. In other words, if your hand is nice and cool because you're in that stress response, how do we warm it up? And usually warm it up quite a bit, which at first sounds a little hokey and can be difficult for people because it takes a lot of different skills. I can talk about that in a second, but it can take several sessions. I think most people will say under 12 sessions for biofeedback to really practice it and make sure the skills are built in and you can use them in different areas. Hey, for some people, it's only a couple. I've definitely had patients where they do it the first time and they got it. They're great at it, and we all have different relaxation skills that we prefer and we do better at ourselves. Their body responds to better. So it's person dependent. I don't think that anybody needs to be doing 100 sessions of it or 50 sessions or anything like that. Want to keep it short and sweet so you have those skills, build them, and can use them when it's helpful in life.
So with the sorts of skills you're mentioning, you mentioned the hand warming. Why would you want to do that?
Ah, yes. Well, if we think about chronic pain, especially the things that you've probably heard different phrasing from it, depending on what your team or your providers have talked about. Sometimes we talk about central sensitization or this hypersensitivity of the nervous system. But really, we're just considering the nervous system getting nice and aroused and working too efficiently, sending those signals when it doesn't need to. And part of what oftentimes teams will say is we need to do something to calm that system back down, to relax the body. Well, these skills are working on not just your autonomic nervous system, but specifically in the brain. We're thinking of your amygdala and we're thinking of your hypothalamus, which are two different areas which do have some emotion control, but they also do a lot with your autonomic nervous system. And they're directly sites that are part of where pain is processed. So if we're able to calm this autonomic nervous system, to get it more balanced, it's going to help out with how we perceive pain or even how sensitive and how wound up that nervous system is. And so that's what most of these skills are for. And again, I'll go back to diaphragmatic breathing. You've heard it so much, some of you, it probably makes you sick to think about. But technically, it's a foundational skill. By calming our breathing, and especially by doing a nice, slow breath, that can really make a big change in our physiology. It can make a change on how we feel emotionally, of course, but I'm really meaning how it affects how much oxygen is released to different places or how tense our body becomes. So it can do a lot by itself. And then if we think of the other skills, I mentioned hand warming. If we're able to do that, and just to, I said I'd mention the hand warming a little bit more. The hand warming skill is tricky because with some of these skills, with diaphragmatic breathing, for instance, you can force it in a way. You can focus and breathe and make it happen. There's another skill, progressive muscle relaxation. You tense your muscles and you relax them, and you force your body to become more relaxed, more fatigued in your muscles. With the hand warming, it's more of a mindfulness skill. So it's more of a letting go type thing. And it's partially because the nerves that go through your hand are all of they're sympathetic system nerves. They're not your parasympathetic, they're not your calm nerves. So you can't force your body to calm. Instead, you have to lower the stress response. So it's all about mindfulness, letting go, and just kind of zoning out in a way, which can be a good skill. It's a good skill whenever you get dysregulated. It's a good skill because if you have pain, it's going to strain and stress your body. And so it can just be helpful if I can do something that allows that blood flow to get back there, that allows my body to regulate. There's efficacy for it for chronic pain, for migraines, especially, and headaches. For any of those, it can be really beneficial. And so there's some good results on it. There's a few studies that look at it. So these skills should help with it. I don't want to say that any of this is going to cure your pain and solve it. That would be silly. I know the limitations, but also know the potential that there's a lot of ways that these can help with how you're feeling, your ability to relax, and then just be able to manage pain a little bit more too.
Yeah. And you mentioned migraines in particular. Would you approach that would you approach treating migraine differently from other sorts of pain?
Uh, Potentially, all these are going to have their own nuances. There's different things you're going to do for migraines, especially if we're thinking pharmacological. That's a whole nother area I don't touch. As far as these skills go, for migraines, I really focus on muscle tension and hand warming,
Mhm.
oftentimes because those are two of the culprits that add to that experience or that can trigger migraines. I know there's a
Mhm.
lot of other things that can trigger migraines too, but especially with the hand warming, again, if we can get that blood flow, part of the thought is if we have pressure building up in those arteries and vessels up here, if we can get the blood flowing again and moving it around, we have less of that pressure and it can help out reduce some of the pain. Again, I don't want to say any of this is curative. I don't think that's how it works. But if we can drop it down a few percentages and give you more control, that's the biggest thing with biofeedback.
Great. We've got a question
Ah,
from
Rose, good question. I love it. All right. What about people with hyperhidrosis and dysautonomia who have less control over these things? Absolutely. And how much success rate can they have compared to people with more of those uncontrollable problems? Uh, I haven't done much with hyperhidrosis, so I don't want to talk too much about it. Although hyperhidrosis and dysautonomia are both uh, conditions with the autonomic nervous system. I know specifically with dysautonomia because that's the area I really care about. And I know a lot of you, if you have chronic pain, probably have some of these comorbidities. Um, Depending a lot on how things come about, why you're having this condition, there's still merit in using these skills. If the thought is my autonomic nervous system is kind of doing its own thing, and therefore I'm getting, for hyperhidrosis, we're getting more of this sweat release, this sweat response. Or with dysautonomia, I mean, there's a whole host of symptoms that can come. But in either one, we're going to say there's a disbalance in that system. So I still think that these skills could be helpful. I know for a fact there's no studies looking at any of the relaxation skills or biofeedback in dysautonomia. I'm not sure about hyperhidrosis, but I would absolutely use them. If we think about anything that regulates your body, whether it be the breathing, the muscle tension, or whatever, if we can get that autonomic nervous system closer to balanced, it should theoretically help out with symptoms. And anecdotally, because some of the patients I work with that have dysautonomia, we use some of these relaxation skills, especially working with heart rate variability, with calming the breathing, slowing the breathing, and we see decent results with how they're feeling symptom wise. And we got to work with some of the things. You don't want to get too lightheaded or dizzy or anything like that, but can absolutely be beneficial.
Access. How would
Oh,
somebody finding a way to do biofeedback? Do you have to do it with a specialist? Can you do it at home?
yeah, great question. Access is one of the tough things. As you probably all already know, access is tough, whatever you're looking for. Sometimes it's tough to find a pain team. Sometimes it's tough to find physical therapy, or it's tough definitely to find a psychologist. I know I live in a metropolitan area and it's still tough. For biofeedback, where I first send people is bcia.org, and that's the accrediting. I'm saying that wrong. It's not coming out. The body that certifies people for biofeedback. And so they're going to have a list that says, I think it's by zip code, providers near me, and it'll just give you who do you have, and you can filter it within how much distance too, depending on what you're willing to do, willing to drive. One of the tough things with biofeedback, it's very difficult to do virtually. You can only do that if the person on both sides has equipment. For instance, I can't hook this up to any of you. That's not going to work. It's impossible. However, there's other ways to do it. So first thing for access, I would say BCIA is a great place to start. They don't have to be a psychologist. There's a lot of different certifications, but honestly, you don't have to be certified. Now, if you get somebody who's certified, they're probably going to have more training. They might do a little bit better. Uh, but by no means is it something that is mandatory. And there's plenty of wonderful providers out there that don't have a specific certification. So I would say working with what you have in your area. The other question was home. Even in preparation for this question, but earlier today, I went online and was looking at different systems and what you can do at home. There's plenty of systems out there. The problem is most of these are going to cost you a couple hundred to $300. Some of them you got to pay that much just for the equipment. Then there's a yearly subscription on top of it. So it can be quite expensive to do biofeedback with the systems at home. And if I'm going to recommend one at home, I'm going to say usually it's something that's going to be heart rate variability. It's going to attach, or you're going to put your finger on something that's going to read your autonomic nervous system like that. It's just a little pricey. Um, you know, if you do have the means where you have a watch or you have a phone that's able to do that, there's a couple apps out there that look at heart rate variability, and you can do some of that yourself at home. Uh, Again, it's just you're at the mercy of how sensitive or how good your equipment is at that point. So it's something to consider. Um, and somebody just asked that. Yes, you can still do this with your Apple Watch, for instance. It just depends on what you want to look at. For instance, if it's reading your heart rate, yeah, you can focus on slowing your breath or doing something else and watch your heart rate change. Now, granted, it also depends what we're doing. If I'm coaching you, for instance, if I had somebody in here and we're focused on getting them in this nice, calm, balanced zone, we might not see a huge heart rate dip. That's not exactly what I look for. If you slow your breathing, it should go down a few heart beats per minute, but it might be that it doesn't change a lot, and that's okay. It's not the only metric we look at. It's just one piece of this big puzzle, which is your autonomic nervous system. So those type of devices can absolutely be helpful. I think especially even the devices that are just walking you through breathing that say, okay, breathe in one, and count to five, and they breathe back. It can give you a little bit of feedback um, and help you focus. If I think about the principles of biofeedback, and this might help with it too, there's three big principles. We got sensory awareness, that's noticing what's happening inside of me. We have control, that's the easy one. That's what we think of when we're, how well do I control this thing I'm trying, my breath, for instance. And then three is how do I generalize it and use it in real life? So if somebody was in here with me and we're doing biofeedback, we might be doing breathing, for example. And so we're practicing breathing, we're practicing slowing it down, we're practicing doing it with a pace. And I might be asking them what they notice, what's happening in their body. Is there tightness? Is there sleepiness? Do they feel it in their diaphragm? Can they see it move at all? Is it uncomfortable or why? And we want to process some of that and figure it out because we got to troubleshoot it depending on what's going on. Similarly, with muscle tension, if we're tensing and relaxing, yeah, I might have them tense and relax. That's pretty easy. If you've ever done progressive muscle relaxation, you tense, relax, you tense, relax. But I might want to do something different, especially if we get feedback with it. Uh, okay, maybe you have tension in your shoulders and you can tense it up and relax it, but tense it to 100, and then let's tense it to only 50%. And then how about you tense it to 25%? And especially with feedback from the screen, you can start to get a feel for, well, what's 25 versus 50 versus 100, which is going to help you earlier and earlier identify when does my body start to get tense. Because if you can identify it earlier in the day or earlier in this process of getting more and more tense, you're going to be able to change it sooner. And then lastly, generalizability being not having any equipment around you at all. It's how do I use this in school, at work, when I try to go out with my friends, when I try to do these things that are actually important to me. How do I then regulate my body when it's game time for this? I mention all that because some of this can potentially be done without the high-tech equipment. If you can still do things where you can practice breathing and start to notice what you feel and work with that to adjust it. If you can still, I mean, you could probably, after this webinar, go and try to tense and see, okay, what is kind of tense versus really tense, and start to get your body used to noticing those really small differences. Any of that can be important. If I think about biofeedback, I think of it much like some extra coaching. Whether it's somebody who is in choir and has a choir director, a voice coach, or somebody that plays sports like baseball and they have a hitting coach, or any other thing that you might do, it's not required by any means, but it can help you really get to that next level of being able to use that skill or find ways that work specifically for you. And that's what we think of with biofeedback, is how do we make it something that works for you in these situations you're going to be in.
Yeah, it sounds like there's a certain overlap with mindfulness practices.
Absolutely. I try mindfulness with almost, well, with everybody if I can, especially when we're doing things like the hand warming or really even the heart rate variability. Mindfulness or mindful meditations, these passive body scans, anything like that is going to be very helpful. Dr. Sherry, I know you do some hypnosis. That's something that can be really helpful, and you can tie into biofeedback as well. Really, any skill that practices relaxing can be beneficial because, again, you're all going to respond differently to these different skills. Uh, for myself, I know how my autonomic nervous system responds. I get hot and sweaty. That's it. I don't get very tense. My breathing doesn't get off, but I will sweat. That's how it works. So I have to do more things that are focused on that area of the autonomic nervous system that are very much temperature based. Where other people, it's going to be their breath or it's going to be their muscle tension. And then we work on the skills that are specific for those areas. And that's where you're going to get the most bang for your buck.
Eh, Are there any people who should avoid it? Any dangers, any contraindications?
Good news, no real contraindications for biofeedback. It's totally painless. There's no damage that happens to your body. I imagine if you have like an allergy to a specific adhesive, that's something you should watch out for. If you have skin conditions, it might not be great either, especially if it's going to be in that area. But no, I've actually, I'm sure there's no contraindication in the sense that it can be damaging or dangerous for anybody, which is good. Um, Now, I do with the muscle tension one, it's called EMG, which there are EMG muscle studies, like a nerve conduction study, where it is kind of painful, actually. Very different thing, very different electrodes. There's no electric charge going through. So none of that. No, it's for anybody. I do think there's things we have to consider, though. First, you got to be, for most any of this, you have to be motivated to do it because a lot of this is practice. I am positive that everybody on here can breathe. Like you've been breathing for years. That's normal. I'm also positive you know how to take a deep breath. You've probably been in a doctor's office and they put a stethoscope up to you and said, take a deep breath. And you went, or something like that. So I know that that stuff exists. However, I think to do the breaths that are very specific to this, so a slow, soft, quiet, in through the nose, out through the mouth, really easy breath, it can take a little bit of training. So I think it's somebody that's willing to do some of those basics, which can be annoying. Everybody since you're four has said, stop, take a deep breath, relax. But to redo some of that stuff and really try to uh, get through the intricacies of it, I think that's a challenge for some people. I think that you know, you have your basics. Is there access to care? The cost of it, depending on where you go. As a psychologist, I can do it as part of cognitive behavioral therapy, which is a psychology code, which typically insurances will cover it. So it's all together. But some insurance won't cover biofeedback by itself. So if you see somebody that's just biofeedback, it might be a non-insurance based charge. So you got to consider that. Um, the question earlier, Rose, thank you for throwing that in there about dysautonomia. I think when there are other conditions where the autonomic nervous system is being challenged, and we don't have enough info on that yet, I think it's something to consider. I definitely don't think it would be contraindicated, but like I said earlier, I mean, dizziness, lightheadedness is so common in that population. When you're practicing some of these skills, you got to be really on top of it to watch out for that, and then work with the patient for it. Also, if I don't know, I imagine most everybody here is either in chronic pain or has somebody they care about who has chronic pain. Some of this stuff is tough. Like if we're doing progressive muscle relaxation and I'm telling you to tense this muscle, which already hurts, it might not be the right thing right there. So, you know, you can play with different modalities. You can adapt or change some of the different interventions you use in this. But otherwise, no, I don't think there's anybody that's off limits for this. And for pain, I recommend it for everybody.
Couple of questions. One is, do you are there ways to predict who's going to benefit the most so that we can sort of identify the kids who are most likely to benefit?
Yeah. No, unfortunately, I don't think there is. The hospital I used to be at, they did a study trying to look at that, where they were looking at different factors about age or motivation or other things to see who would benefit from I think they had a 5 session biofeedback program they were doing. And they didn't really come up with much. You know, some people that are more engaged are getting better results, obviously. Um, but it's hard to tell. And is probably everybody on here knows when you're dealing with chronic pain, it's not just that, you know, we do 1 + 2 and then it equals 3 and you're better. If it was, you wouldn't be on here. I mean, it's obviously a complicated thing, it's a puzzle. And so I think we added in as part of this treatment plan because we want to hit it from all the different angles. This is something that's complicated.
Mm.
um, Again, I think it benefits anybody. And I know plenty of people that say, hey, I've tried, you know, diaphragmatic breathing, it doesn't do anything for me. And yeah, I don't know if it's going to take away your pain. Physiologically, though, at very worst, it helps calm that nervous system. And that's at very worst if done properly. So I think for anybody, it can be beneficial. I just don't know how to predict it, though.
Yeah.
Yeah. So, Erica, let's see. We're talking about the centers. Yeah, it depends on where you go for a center. So the question is, do they treat children? Absolutely can. It depends on the provider, much like anything else. If you're around any children's hospitals, that's typically your best bet, especially because they're going to be focused on kids, and you can usually search their website to see if they have biofeedback or who provides it. Excuse me. At different hospitals, sometimes it'll be occupational therapy, a pain clinic. It might be a psychologist. It can really depend who does it. Uh, but yeah, I would start there. Or even if you get a list of people to just ask around, hey, do you do that? CHLA definitely does it. I'm almost positive they do it because I know a couple people there. So you have that. 9-year-old, first off, with CRPS, that's tough. CRPS is such a difficult condition to work with. And they have ADD too. Oof. Will they sit through the appointment? Maybe. I can't guarantee it. A lot of times, though, when we're working with kids, we make it more fun and interactive. So some of the biofeedback programs you have. So what it'll be is that I'm attached over here. I have this on my finger, and on the screen beside me, there's something going on. For kids, we want it more gamified. That as I'm breathing and as I'm breathing in a way that's helping my heart rate variability and I'm breathing more efficiently and I'm breathing on pace and my body's liking it, then stuff happens on the screen. Maybe it's a picture that changes, or maybe it's a literal game where I'm getting coins, or there's two rocket ships racing. There's a lot of ways it can be done in a lot of different systems. So it depends. Uh, but definitely, I have one game on mine where it's a race car game, and kids love it. And I've done it with kids as young as 8. So yeah, I think some kids, especially ADD, when they get into the game mode, they say, yeah, I can do this. It can be frustrating though, especially if they don't have the skill. The games can be very tough because some of them are built to be frustrating. Uh, yeah, are kids open to practicing that? Sometimes. I definitely teach relaxation skills differently to my elementary school age kids than a high schooler. If I'm working with a high schooler and we're doing progressive muscle relaxation, I'm not gonna say they're doing tightening of their stomach. I'm not gonna have them lay down and act like an elephant's coming and stepping on their stomach, which I sometimes do for my little kids to get them to squeeze and have fun with it. I think you have to approach it a little bit differently. And with CHLA, or really anywhere you work with, or anywhere you're working with that specializes with kids, hopefully for a 9-year-old, they're going to be able to say, hey, let's do it a little bit differently to keep them engaged. Um, and yeah, I mean, they should be making it more fun for little kids. That's the goal. I mean, or even teens sometimes. I like to have fun with teens as well, but definitely for a 9-year-old, we want to.
Changing behaviors.
Oh, yes.
I know that for hypnosis, for instance, certainly we see a lot of people for pain management, but also trying to change different sorts of habits or help going to sleep. And I'm wondering whether you can use biofeedback like that as well.
Yeah, it depends on what the behavior is, and there's limitations to it. So biofeedback, again, is really focused on self-regulation. It's focused on what's happening inside your body to get a good feel for it, to get control over it, and be able to calm, relax your body. Some behaviors, they're based off, let's just say anxiety. We'll pick on that for a second. So let's say somebody has anxiety and because of that they smoke, or because of that they overeat or don't eat, or whatever the behavior might be. Then we could say we can use biofeedback as part of that treatment to then reduce that anxiety that's leading to a behavior. Whereas hypnosis, you can more directly address the behavior. Biofeedback's more of that, how do I regulate myself so some of these unwanted behaviors don't happen? Um, I
Even
saw in
longer.
the chat somebody wrote what's different with neurofeedback and biofeedback, and I can actually tie that into the question. With neurofeedback, you're looking just at brain waves, especially your beta and theta waves. Uh, those are going to be, oh, I'm going to mess this up because I never do neurofeedback. Beta waves, I want to say, are more your calm waves, where theta waves are waves that happen in times of a lot of drowsiness and or overactivity. And so basically, when you have that cap on, you're doing the same thing with the screen in front of you, and you're trying to relax or change kind of what your body's doing so that those waves change, or how much of those waves are active. And people have tried to use that a lot for ADHD, especially. So we could say behaviorally that could help. If you're able to regulate, then in school or wherever else, you may be able to regulate that. But typically, no, this isn't seen so much for a behavior, biofeedback that is it is for these very specific symptoms or problems. Sleep would be the exception where I'd say absolutely use all these skills before sleep. It helps calm and regulate your body. It's so good. I use it myself.
Right. And it's separate from sleep, does it have any impact on fatigue?
Yeah, so fatigue's interesting. And um, also, when dealing with the chronic pain group, I mean, I would just bet money that the vast majority, if not all of you, probably struggle with fatigue. It's a huge thing in the chronic pain world. Um, you know, you may have heard this from your providers before. The answer for fatigue is to do more, to get that blood flowing and to move, which is brutal because it can already be so difficult because I'm in pain. I feel like crap. It's hard to get out of bed in the first place or to move around or to do activity. And when I do, I feel like I'm out for 2 days. It's tough. And I wish I had a magic wand for that one, and I don't. If I think about the recommendations or what the literature would suggest, it's going to say graded activities. So starting real slow, wherever you're at, we're all at different places. Starting slow and gradually building. And there's been a couple studies that look at adding biofeedback to that, especially with heart rate variability, and really focusing on improving the heart rate variability. Um, think about it like this. If heart rate variability, that's how your body responds to all the things that are going on throughout the day. If you stand up, your body has to respond to that movement. If you talk, if you laugh, if somebody does something, opens the door and surprises you, all of those, your body just adjusts. That's, again, your autonomic nervous system doing this throughout the day. Part of the thought with chronic fatigue syndrome is that's off, and the heart rate variability, improving that allows you to adapt to those I don't want to call them stressors, but strains that are happening to your body. I think about it that if heart rate variability is good, so this nice, we don't want your heart to be a metronome and just beat. We want it to, again, adjust to all the little things. The better it's able to adjust, the more we call it like power or amplitude it has. It's more like if you're pushing a swing and you're hitting it on the sweet spot every time, swing comes back, you hit it every time. Whereas otherwise, a bad heart rate variability would be somebody coming back and you push too early and everything gets shaky. If we improve that swing, we're basically talking about the efficiency of how your body works, how the blood flows, how the oxygen gets released, and everything else, which should, again, this is more theoretical, sorry, it should help out with fatigue. Saying that fatigue is part of that, the blood isn't going as it should, the oxygen isn't going as it should, and I just feel like, blah. So again, there's only 2 studies I can think of that have looked at it, and both of those were biofeedback focused on heart rate variability and paired with graded activity. So I don't want to oversell it and say, hey, you're going to do biofeedback and all of a sudden you won't have fatigue. I think that's kind of silly. Rather, it can be part of what you do to give you another little boost to get you to the next level.
And how long, like how many minutes do you have to do biofeedback to start to see a difference?
This question has been debated so much. How long do you have to do? There will be some people that say you need to do 20 minutes, 20 minutes straight, not even a day, 20 minutes straight, like big old long time. That's not going to happen for most people. Other people say 10, 5. What you got to think of is how long does this take to affect my body? And then how long do I need it to get something from it? So for some people, if we start doing, I'm just going to go with diaphragmatic breathing. It's the easiest. Say I'm doing diaphragmatic breathing. I've learned that skill. I can see myself doing it. Um, some people almost immediately their body will fall into sync, especially because you have a thing called your vagus nerve attached to your diaphragm. It activates your calm response, your parasympathetic nervous system, pretty much in all your major organs. And the more you work that connection, the faster it works. So for some people, it can happen almost automatically. But let's say we only do one breath, I'm in, I'm out. That's all you got. And so it's really that additive effect of can I breathe in, breathe out, and do it for longer and longer. And that's where we're going to see stuff happen. That's where we're going to see more change happen. We're going to see, if we think about what happens when our body's nice and calm, that's our immune system. That's growth hormone. That's your ability to encode stuff into long-term memory. So we're going to get more benefit the more we do it. But for people that don't tolerate it, I mean, some people hate practicing things like breathing. I say, hey, do it when you're in the car, do it when you're in the shower, when you're in the bathroom, when you're walking somewhere, and just try to do these mini exercises throughout the day. But I tell people do at least 2 minutes. And what I see a lot of times when I'm working with biofeedback and I can look at somebody and see how their body's responding, often takes 60, 90 seconds to really get the body going. Um, this is important, by the way. Um, I think about it by like a car. If you tap the brakes on a car when you're going 80 miles per hour, you are not going to stop. That's not how it works. You would have to tap it several times to really start to feel that slowdown. The first couple times, you're still going to feel like you're speeding. This is very much the same. If we're already somewhat aroused and we try to do this breathing, you're not going to notice much from it from the first or second time. It's this repetition of it more and more, and then we're going to feel it. And you're going to feel more of it proactively. When you're going 5 miles per hour, you really feel the brakes. When you're more calm, you're really going to notice some of these skills working. Olivia, I see your question and I feel your pain. I honestly do, because I had been there before. Um, Question: why do I feel more anxious when I do deep breathing for several minutes? It can be a host of reasons. I don't know yet, and I can only guess about things. So if I totally missed the mark, my apologies, Olivia. I would say, first off, it depends on what our baseline is. For most people with breathing, let's say it works and it's effective. I'm going to first go say someone's anxious. If someone's anxious, any change doesn't feel great. I like being here if I'm anxious. If I get more anxious and I get more panicky, well, I definitely don't like that. But even if the body calms down, that can still feel threatening to the body, and still cause some of that anxious feeling. For other people, it could be nothing to do with that. It could just be how we're breathing. Sometimes if we're breathing way too strong, it can also cause those same effects where it can make us feel quite anxious. Um, I'm going to give a little science lesson. Sorry, this is a little off script, but I like doing it. All right. If we think about how breathing works or how the body works or why we even do this diaphragmatic breathing thing, we want balance. That's the main thing. And as you probably know, you breathe in oxygen, breathe out carbon dioxide. You've probably known that since you were a little kid. All right. When I breathe in oxygen, that's good, but usually I'm pretty much saturated in oxygen. You ever been to the hospital? You look up on the monitor and it says oxygen saturation. It's going to be mid to high 90s. You got enough oxygen pretty much at all times. We do, though, need carbon dioxide. It is our friend. We want it in our body. And as we use oxygen, carbon dioxide builds. We want that to happen. And as carbon dioxide builds, the blood turns more acidic, and that releases hemoglobin, which then allows oxygen to go to all those important places in our body: your brain, your muscles, your bones, everything like that. That's good. We want it. Okay. So if we start breathing a little bit off, and that can be a breath that's too strong. I breathe in. All right, I'm already saturated, but then I breathe out this big breath of carbon dioxide. If it drops too low, and this can happen 5, 6 breaths that are off, then the carbon dioxide doesn't build as high in the bloodstream. And then we don't get that acidic change, or our body might become more alkaline even. We don't get that acidic change, and then hemoglobin's not released, and oxygen is trapped. And so it doesn't get where we want, which can make someone feel anxious. It can make you feel numb and tingly and all types of things. It's really hard to know without doing the biofeedback and seeing it. In fact, let's even take this a step further. Let's say I breathe in. Okay, I'm trying to relax. And when you watch the Olympics this summer and you see an athlete do it, just shake your head at them. That's not how they're supposed to relax. It'll hype you up, but not relax. All right. I released a lot of carbon dioxide there. All right. Well, hope I still don't feel relaxed. Now, if I keep doing this a couple more times, I'm going to start feeling lightheaded, and this is not going to be good for any of us. But let's say I keep doing it. What happens, I'm lower and lower and lower in carbon dioxide. I'm more and more alkaline. Carbon dioxide isn't building, so oxygen is not getting released. I have full storage of oxygen. It's not going anywhere in my body. So then I feel like I don't have oxygen. So what do? I keep on breathing. It's called hyperventilation. You've probably been there before. Now, I don't know if anybody knows the old school way for helping out hyperventilation. Dr. Cherry, do you know this one?
The breathing in a paper bag?
Breathe in a paper bag. And the reason we do that is if you have that paper bag, you have to breathe back in that carbon dioxide, which then increases that carbon dioxide in your blood, which causes that effect to release the hemoglobin, allows oxygen go where it needs to go, and you no longer have that need to breathe, breathe, breathe. Olivia, that could be part of it too. I'm not positive, but it's things to consider. So if we're too anxious, it can be a problem. If we breathe too strong, it can be a problem. Um, or I don't know, there's other things. It depends on how you're doing the breathing. I always tell people slow, soft, relaxed. Sometimes with my teens, I'll joke, your breathing needs to be like you're in a closet. There's a serial killer outside of it. You want to breathe real quiet, real slow, real soft. I know it's kind of morbid, but sometimes I think it's funny. So that can be a piece of it.
Now, can somebody tell while they're doing it if the biofeedback is working?
Yeah, usually. So when you're doing biofeedback, there's two different things you can tell. One is you can look at the screen and see, hey, am I breathing in a way that's with it? Am I able to make this change happen on the screen? And that's the beauty about biofeedback. I mean, all of us could practice any of these relaxation skills and you might notice. But with the screen, you can really tell what's happening inside of me and you have some objective data to look at and make sure, hey, I'm doing this right. But you don't have to. Again, people for years and years have been doing stuff without screens, and it's all about what you feel physically too. Again, that's that sensory awareness. Do I feel more relaxed, or do I feel terrible? Do I feel like I'm more anxious now? And those are going to be great cues to, well, what do I need to do to adapt this? Or maybe this isn't a skill for me right now. Maybe there's something else that works better, and that's perfectly fine. But yeah, the screen and having that should give feedback on both. At least, am I doing this skill in a way that's controlling it?
So if one is doing this at home, are there different sorts of tools that you can use or different kinds of, or do you just have to feel what it feels like?
Yeah, it depends. If you're using biofeedback, of course, you can use that to see it. But a lot of times you're going to have to feel it. Even myself, when I'm doing this, and I practice with biofeedback whenever my patients are doing it, I do it by myself sometimes because I like to make sure I got to do the skills all right if I'm going to teach it to somebody. But when I do these at home, I mean, it depends on my week. It depends on my days. Some days I'm doing it and I'm like, oh, yeah, I got it. Other days I'm like, whoa, something is off. And so, yes, you got to know your bodies. Again, chances are every one of you knows your body pretty well. You're almost probably hyper aware of it at times just because you've had to pay so much attention to it before. Um, so I think when something's going well with it, when something's not going well with it. And I think the more you can do that with the things that are relaxation based rather than pain based. So really shifting that focus to how do I get this calm sensation? How do I get this warm or relaxed or whatever that word is for you, sensation with these skills? That's what I really focus on at home is how do I build those up or try to shift towards those?
Okay. And could you give us an example or two of real life patients who benefited from it?
Sure. Yeah. Um, Let me think because I do this with pretty much all my patients.
Yeah.
I've had a couple where, let's see, I got one I can think of with muscle tension where he had a history of hypermobility. So I can't remember if he had an actual diagnosis of EDS or not, but he did have the subluxations where his shoulders and knees did not like to stay in place. So we did a lot with muscle tension because for him, there's a lot of fear of movement, and rightfully so. He'd had some not so fun experiences with that, and then a more of a widespread pain too, and really focused on his body being tense versus relaxed, and he'd hold his body at a very tense position at most times. And for him, it was more of just feeling more relaxed, comfortable with his body. And I think for him, just seeing, oh wow, yes, I am really tense. I hold it in my shoulders, I hold it all through my body. This can be something that helps me relax it. And I've had plenty where um, the conversation usually goes like this. Hey, we're going to do some foundational stuff. We're going to practice diaphragmatic breathing. They roll their eyes really hard at me and say, I hate this. It doesn't work. And I'm like, I know you do, but let's just try it. And then we practice it. And then they see some of the things that aren't going well in their system. And they say, oh. And I think that's just a nice way of, for some people to get that control back of their body to say, oh, I thought I had it, but now I have this deeper level of control and really feel like I can do something with it. And so I've had a few people where, especially when anxiety is a concern, or just this over breathing on a regular basis where they've got more attuned with their breathing and how their body feels. So where they're able to catch it when they're in school, catch it before they get in an argument with somebody, catch it in these situations that really matter.
So it's almost in a way like holding up a mirror to someone so
Yes,
they doing.
absolutely. But that mirror is looking inside of you, which is just a really cool mirror to use. Because, you know, to be quite frank, chronic pain, I can just guess by base rate that some, if not the majority of the people in here have had somebody say, hey, yeah, this is in your head, you're anxious, you're crazy, or something stupid like that, which isn't true, obviously. And so I think when you can look and see in your body, like, yes, this real thing is happening. Obviously, the pain's real too, but something that's objectively measured that we can look at and have control over this thing that I don't feel I have much control over, especially this part of my body. It can be so helpful. Um, and so that's one of the reasons I really like doing it is for my patients, I like to, hope it can help validate some of their experience, but even more so, just give them more of this feeling of there's something I can do about this experience I'm having, and especially when the experience is quite difficult.
Great. We've got a couple of minutes left, and I'm curious,
Yeah.
are there questions that we haven't asked you that things that you think would be important for people to know?
With biofeedback or any of the relaxation skills, I really like people to focus on it as a skill and not a pass fail. I say that because a lot of people, we say, okay, I tried it, it didn't work, it's done. I don't like to throw everything out. I like to keep it in the toolbox. I think about professional athletes. Um, I like to watch baseball sometimes. My favorite baseball team, Tennessee, just won the national championship. Yay, go balls! But the players there are professional players. Let's say hitting, they practice all the time to hit. They've done, I'm sure, different coaches, and they've done batting practice and years and done this. They don't hit the ball every time. I wouldn't call that a failure though. And similarly, when we're thinking about these relaxation skills, you use them and sometimes they're going to work beautifully. Other times they're not. They're not going to be there for you. You're going to have this tough situation and it doesn't happen. And I think that if we keep on trying it, we're going to get more from it. So I don't want people to give up on these. That's the biggest one. Like, keep on using the relaxation skills. People have been doing these for decades and decades because they really do physiologically help people. But to know that even if you become an expert at it, it still is not going to give you everything you want every time you use it. But that's why it's nice to have a whole plethora of different skills to pull from. All right. I see a
Yeah.
question. Is there a sweet spot for introducing kids to biofeedback or certain ages? No, I don't think there is. I don't think there's a time or a window we have to get it in. In fact, I think earlier the better. I think that at any age you can learn this stuff. At any age you can do biofeedback. At any age you can do the relaxation skills. You got to adapt it again to how people are. But I think the earlier the better. Um, let's think about pain for a second. You're in pain. It's like, well, what do I do? Well, we all know acute pain stuff. I can put heat on it or ice on it or I rest it, and that doesn't necessarily help. Well, what else do I do though? And I think this is the next easiest thing. Well, how do I relax my body? Again, I don't want to say that if you're in big pain, you're 8 out of 10 pain, you're going to do a couple of these relaxation skills and boom, everything's perfect. That is not how it works. But maybe it gives you more control. Maybe it does help relax you. Maybe it knocks it down to a 7 and something else can knock it down to a 6. That's awesome. That's what we want to start doing with this. And some people get a huge response from it. Again, it depends on the person and what skill and how they go with it. But I would say this is one of the first things I'd want people to be able to learn, regardless if you're 8 or 18. Um, and then we throw the other stuff. Are there other coping skills or cognitive skills? Everybody probably uses a distraction, which is a great skill. Keep using it. So yeah, I would say no sweet spot. As soon as you can, throw this into your arsenal. It's something else that's going to be beneficial.
And when somebody comes in to see you, do you define ahead of time um, what outcome you're looking for, or do you just leave it open?
Open. I think you gotta, everybody's different. I mean, everybody on here has a different pain journey and experience, and two people with the same condition are going to have much different experiences with pain. So I think it really depends on what's important to the person. Is it like I want to get back to school and I need skills to help me there? I want to just be able to get through the day or get out of bed or wherever they're at, or even where they are with just dealing with this pain response. It's always going to change a little bit. So I always try to keep open and meet everybody where they're at. Um, Olivia, I saw another question for you, and I want to make sure I can hit it. And you gave me a hard one, so thank you. Uh, so, what do you do when the nervous system is in this freeze mode? Is there anything to avoid that with biofeedback, or what would be the best first step? All right, so fight, flight, or freeze. If we think about this, and yeah, technically it's fight, flight, or freeze. They're all part of it. Think about it very biologically. You're getting, bear pops out. Boom. Okay, do I fight the bear? Do I run from the bear? Or I'm so terrified that I can't move. Well, that happens even when there's not a bear. I mean, it happens in tests. That's a huge one, or other situations. Um, I think it depends on how your body responds. I think having a nice cognitive thing to say and a nice little mantra or something to break you out of that freeze would be one of my first go-tos. Is talk. Is there anything to avoid? I don't think there'd be anything to avoid with biofeedback. I think you would still want to get everything balanced. Um, yeah, I'm trying to think if there'd be avoidance or any of the things that I wouldn't do with biofeedback, but I think I'd more just try to tailor it to what the person would respond to the best. I'm already frozen. Maybe I'm not going to tense up anymore. Maybe I'm already real tense and it's going to be hard to relax. Let's not start there. Or maybe I just need to remember to breathe and that's where I need to start. Um, so it's really going to be dependent, but no, I wouldn't say there's anything I would avoid per se. It's more of let's find that specific one for you that works and let's start there.
All right. Oh, and we do have a comment.
Yes, very helpful for medical anxiety or procedural anxiety. I have one of my patients that's very dear to me that has a big procedure coming up here tomorrow. Oh, it's almost happening. And we have practiced so much biofeedback with imagery too of what's going to happen. And there's some uncomfortable parts that are going to happen. And yes, it's something that I think has made her much more confident going into it. Is it going to take away all of her pain? No. But I think she'll do a lot better because she has the skills.
Great. So it sounds like there's a lot of skill building involved.
That's what it's all about.
All right. Well, thank you so much, Dr. Frye, for
Yeah. Well,
your information.
and enjoy being here. And for all y'all that have been watching, hope it's been helpful. Keep hanging in there. Pain is a tough road, and there's a lot of things that can help you. And even if they're not helping now, they might help later. So keep your head up.
Thank you.
Thank you all.